Hello everyone. Today we are going to discuss digestive system. In that, the disorders related to the digestive system. Myself, Dinesh Dangar. While coming to the disorders of the digestive system, we will discuss disorders which may affect digestive system, or it might be because of alterations in the normal physiology of digestive system. While considering disorders, the first and the major one, that is appendix, and it will be present at the initiation of the large colon, that is large intestine. As here you can see in diagram that specific ascending portion of the large intestine. At the basement of that specific ascending portion of large intestine, there will be a presence of appendix. It will be present in normal individual or in all persons, but it may not have a symptoms. When exactly symptoms, or it may create problem, or it may lead to the pain sensitization or the pain. In many cases, due to the infection of that specific segment, that is appendix, can lead to have a inflammation of it, and that specific is appendicitis. Where exactly it can be treated with the medicines, that is anti-inflammatory medicaments, and in many cases it can be removed surgically for the symptomatic relief. Next one, now we will discuss ulcers. While considering ulcers, as we know that what are the basic reasons behind the ulcers. In many conditions, there will be a increased production of gastric acid, or there will be a imbalance between the released amount of acid and their neutralizing substances. Ulcers can be seen with the normal mucosal erosion. There will be a erosion, and that erosion may be bleeding or non-bleeding. So on the alimentary canal, there will be a erosion of the superficial surfaces. In cases of superficial surface, it may not be bleeding. If it is penetrated deeply, then there might be a bleeding, and it will be generally associated with some kind of irritant. Here, irritant molecule can be any medicine. It might be because of increased production of acid secretion, or it might be because of certain other reasons. On the basis of location, that is anatomy, it can be divided into their three major types of ulcers. If it is present in esophagus, as here you can see in diagram, the first segment, or the what we can say that the end portion of the esophagus, right? Where exactly if there might be a ulcer, or that specific craters or the erosions are seen, it means it can be termed as a esophagitis. Remember, if ulcer is present in esophagus, we used to call it as a esophagitis. Whereas in the cases of stomach, it can be termed as a gastritis, right? It is gastritis. And if the ulcers or craters or the erosions are seen in duodenum, that is what, the first segment of the small intestine, it can be termed as a duodenitis. Next one, that is constipation. Here, while considering constipation, right, again a kind of medical condition where the defecation process may be delayed, right, and it involves the the portions of the large intestine. And while considering the defecation, the process of defecation may be associated with the pain, or the defecation will be painful. In many cases, there might be reasons like from that specific fecus, the too much water will be reabsorbed back into the system, and it makes the the fecus so hard or the solid, right? So that the solid waste may hardens, and it may be because of the in many a condition, like the person may be having constipation from so back or so long time, and he or she may be consciously ignoring or preventing the defecation reflexes, or it might be because of the due to the decreased colonic motility. In many cases, decreased colonic motility may be seen, so that from one segment to second segment, stool may not be passing. In secondary cases, like aging even can be responsible behind it, even emotions. Next is it might be because of low food intake or the low bulk diet, or it might be because of the atonic or the spastic colon. It might be because of the chronic amoebiasis, right? While considering, it is not a disease, but we can show that it could be a symptoms because of other diseases, or it could be a symptomatic due to the other diseases or due to the secondary infection. Next one, that is diarrhea. See, diarrhea is entirely different than the opposite is constipation. Right? Here, in cases of constipation, too much water will be reabsorbed inside the body from the stool. So it makes stool so hard. So that while going with the defecation, it may be even bleeding or blood or pus formation can be seen in stomach, in feces. Whereas in the cases of diarrhea, the stool will become watery. It will be become too watery, and the reason behind it, that might be because of the water absorption that can be done in large intestine can be retarded, or more and more water will be secreted over the site. Here, diarrhea is a gastrointestinal disturbance, and characterized by the decreased water absorption from the stool, and increased peristaltic activity of the large intestine. And due to that increased peristaltic movement, food may be passes in a speed or in hurrying, so that there might not be enough time that water can be retained in the body or from the large intestine or the colon. This results into the increased or multiple and the watery feces, right? It produces water fecus or watery fecus, and it increases the frequency of the passage of the fecus. Here, while considering this condition, results into the severe dehydration, especially in the cases of infants. Here, as I stated earlier, while considering the primary cause is greater intestinal motility with less time for the absorption of the food material which is present or the specific segment, that is large intestine, right? And thus there will be the delivery of a large volume of fluid to the large intestine, and it may lead to the overloading of it and its capacity to absorb the salts and the water, and it may result from the infection, allergy, or it might be because of the dietic indiscretion or the toxemia. Next one, that is appendicitis. As I stated earlier, right? Appendicitis. It is basically an inflammation of the appendix due to the infection. Here you can see in diagram that specific segment may undergo inflammation, and as you can see that red color might be changes that red color due to the increased activity of the RBC cell as well as WBC cell, or we can say that like blood gathering or the the edematous fluids may be formed over there, and it could be the reason behind the pain, right? And that can be felt in abdominal cavity. While considering the common treatment is removal of the appendix via surgery. But in many cases, if it is because of infection and it can be treated with the medicaments, it will be well and good, right? So that no need of surgery. But in many cases where it may have a frequent occurrence, or might be a pain associated with the appendix, can be surgically removed. Next is gallstones. See, his name indicates gallstone. These are the stones which are present in gallbladder, right? During last lecture or last video, we had a discussion on the accessory organs like gallbladder, next is pancreas, and the gallstones. In that, the gallstones are formed in gallbladder. Why? Because the major function is to, while considering gallbladder, that is to concentrate the bile juices. While considering bile juices, if it is filled up with the 10 cc of the bile juice, out of it 9 cc will be concentrated, and only 1 cc of the bile juice will be remained over there, that will be carried up to the bile duct, and through that bile duct it will the further it will be added or mixed with the secretions from the pancreas, and it will be added into the duodenum. So while considering here, there will be an accumulation or the hardened cholesterol and or the calcium deposits, right, in the gallbladder. As we know that these are all the components of the bile juices. So it can either be passed or surgically removed. Next is anorexia nervosa, right? Anorexia nervosa. While considering anorexia, right, we can say that a kind of a condition where person may have a loss of appetite, right? So may not have a integrity or the ability to have a food due to the the imbalances in nervous system. Here it may be resulting from the local or the general causes, and also or due to the anxiety or the depression for the or towards the food. So here anorexia nervosa is a kind of psychological state or condition where an individual thinks that they appear overweight and refuses to eat, and most probably it weighs 85% or less than what is developmentally expected for age and height, right? In many cases person may think that he or she is too obese, so he or she try to refuses the food, or toward the consumption of the food will be reduced. So that is a kind, that is what anorexia nervosa, and it can be seen with the generally young girls, right? They do not begin to menstruate at the appropriate age because of anorexia nervosa. Next is the heartburn. Actually, heartburn is a part of GERD, that is gastroesophageal reflux disorder. Remember, it is a part of gastroesophageal reflux disorder. In many conditions, what exactly happen that there will be a constriction of stomach, and due to that constriction of stomach, the food tries to enter into the esophagus again, right? Here the food which is present inside stomach, it tries to enter into the esophagus through the cardiac sphincter or cardiac orifice, and that food again may enter into the esophagus, leading to the burning sensation, right? So that acid will be enter into the esophagus, and esophagus may have a irritation for or the towards that acid. It can lead to have a pain into the chest or the cavity or the thoracic cavity. So that's why the symptoms may be just like a cardiac arrest. So that's why the name is given, that is heartburn, right? That is from acid from the stomach back up into the esophagus. Here we can see there's the normal physiology, right? While considering esophagus, diaphragm, next is the gullet, that is the opening, and next is the stomach, that is filled with the acid. In cases of heartburn, there will be a acid reflux, right? And it is caused by the acid which is found inside the stomach, where it helps to break down the food and rising up into the gullet, leading to move that specific acidic content into the esophagus. Unlike the stomach, the gullet does not have a protective linings, right? That gullet may not have a those protective membrane or layer, and so it becomes sore and the inflamed or inflammation, right? So these are all the disorders which are related to the digestive system. We can include others like nausea, right? Nausea is a kind of like we can say that feeling, and that feeling can be distressing feeling of the vomiting, that is just prior to the vomit, right? Before induction of the vomit, there will be that kind of symptom or the feeling that can be termed as a nausea, and the cause may be local or the general causes. even in many cases of we can consider like a sight or the kind of vision or what exactly is happening just before you, that bad smell. Next is that kind of vision or the kind of sight what you have already seen, right? These are the general or the local factors which can have a nausea. Even while considering certain medicaments, while doing with the chronic administration of it or for a longer term uses may lead to the nausea. Again, vomiting is again kind of a sudden spasmodic expulsion of the content of the stomach, right? The content which is present inside the stomach will may have a expulsion, or it will be sudden in nature, right? While considering the original cause is generally in the stomach or elsewhere, right? And it may be acting through centrally or the reflex or the toxic or any kind of obstructive in nature, which can have a vomiting. Again here, smell again, due to the bad smell, it may sensitizes the the higher centers of the brain, leading to the vomiting. In many cases, again, vomiting is essential or useful, like while considering the drugs like emetics, right? In a cases of certain poisoning, where person may have intended or unintended cases of the poisoning, right? They may have a poison. In those cases, those emetics like charcoal or the mustard powder that get what sodium chloride, and these are all the substances which are available within the kitchen. It can be used as emetics, where exactly due to that specific drug or that specific treatment, it may lead to have a forceful expulsion of the content of the stomach, leading to have a vomiting. Next, as I suggested earlier, gastritis, right? Gastritis, where exactly that acute or the chronic inflammation of the gastric mucosa, and that might be because of the irritant or the infection, emotion, or the due to the obstruction, leading to form, ulcer. That is what gastritis. We have already discussed heartburn here. Next is cholecystitis, right? Again, it is the inflammation of the gallbladder. um, we have gastroenteritis. It is again clinical syndrome, and that can be manifested by the upper gastrointestinal symptoms like nausea, anorexia, vomiting, and the abdominal discomfort, and even we can consider diarrhea too. Here it may be due to the bacterial or the fungal infection or due to the poison ingested. Next is we can include here dysphagia. Again, it is a subjective awareness of the difficulty in swallowing, right? A person may have a difficulty in swallowing of the bite what food he or she used to consume, and due to the impaired progression of food or matter from the pharynx to the stomach. Dysphagia is a condition where exactly the food can be chewed in oral cavity, and again it may enter into the esophagus, and it may reaches up to the cardiac orifice. But due to the certain reasons, it might be because of GERD or the inability to proper contraction and the relaxation of the cardiac orifice, the food may not enter into the stomach, and it may have a reverses, and it may reverses to the esophagus and the oral cavity, and there will be a vomiting. That is dysphagia. Next is we can consider aerophagy, right? Again it is the same swallowing disorder, and it is the swallowing air in the stomach that is unknowingly, that air may be reaches to the stomach. That is aerophagy. Next is we can consider PUD, that is peptic ulcer disease, right? Where ulceration of the mucous membrane that may penetrate through the muscularis mucosa, and it occurs into the the specific area, which may undergo continuous bathing of the certain segments or certain parts like acid and the pepsin, right? In again maybe in the stomach or the duodenum. Next, and for the further diagnosis of these are all disorder, specific technique is available, that is endoscopy. Right? Endoscopy is a technique where the hollow organs can be viewed with the help of the instrument or a tube-like structure, and on the tube on that specific top of the tube there will be a light that can be have a visualization of the specific craters or the unintended certain what we can say like symptoms or in stomach, right? What we can observe, we cannot observe through the naked eye. So here endoscopy is used, right? So it is a technique to view the whole organs from the inside, and the viewing stomach from inside with the light and the magnification, right? Again, we can consider it as a gastroscopy. So it is a kind of a good diagnostic tool for the stomach disorders, particularly in cases of peptic ulcer, right? Where we cannot have a proper visualization of those ulcers which are present in stomach or the duodenum. Next is we can consider in cases of disorder, that is peritonitis, right? Peritonitis, that is a kind of acute inflammation of the visceral and the parietal peritoneum layer of the abdomen, which is again a total surgical entity. Next, we can consider those piles. These are the swallowings, that containing dilated or the varicose veins that is situated into the mucous membranes of the rectum or the skin around the anus. We can consider even inflammatory bowel disease, that is IBD, right? In cases we can further divide it into two, that is Crohn's disease and the ulcerative colitis. These two again are different. In cases of ulcerative colitis, it may involve certain segments of the gastrointestinal tract where exactly there will be necrosis of that specific layer, that is mucosa, and there will be bleeding, or it might be bleeding, and there will be a chronic inflammation of it, and it will not be in a continuous fashion. There will be a skip lessons can be seen, whereas in the cases of Crohn's disease, it will be in a continuous manner, and it may generally involve the large intestine, and after that there will be a skip lesions. Sorry, there will not be a skip lesions, it will be in a continuous fashion, right? From the lower bowel to the large intestine, from that small intestine and the duodenum up to the duodenum, it can be seen. In cases of even disorder like fatty liver, right, where exactly those triglycerides will be accumulated inside the liver, and in it will be in a much amount. And for further again here, certain light microscopy can be performed for the diagnosis. Here next, while considering accessory organs like liver, for liver, in cases of liver hepatitis can be seen, right? Again, a kind of inflammatory condition that is associated with the liver, and it can be characterized clinically as well as histologically, where we can see the evidences of the diffuse or the patchy hepatocellular necrosis affecting all lobules of the liver, and generally those hepatocytes are, or the copper cells are associated with it. And common inflammations are even due to the amoebic hepatitis and the viral hepatitis. Next is liver cirrhosis, right? Again, liver cirrhosis is a kind of disorder where exactly it is the hardening of the liver, right? The liver may become hardened, and the major cause behind the liver cirrhosis is due to the alcoholism, where a person may used to have a chronic administration of alcohol, and that hardening of the liver and the blocking of the liver sinusoids can be seen, and it affects on the metabolic activities which may be carried out inside the liver, and it often produces ascites, that is again free fluid which may be generated into the abdomen. We have already discussed about the gallstone, right? That stone that is formed inside the gallbladder, as well as in many cases pancreatitis can be seen, where exactly pancreas may undergo inflammation. There might be again a number of reasons behind it. In many cases, it can be treated with the medicines, right? So what we have discussed today, that is the disorders of the digestive system. In that we have included starting from the appendix. Next is the constipation. We had a discussion about the diarrhea. Next is the nausea, vomiting, anorexia, that is anorexia nervosa. Next is gastritis, heartburn, cholecystitis. Next is gastroenteritis, dysphagia, aerophagy. Next is PUD, that is peptic ulcer disease. Next is endoscopy, that is a kind of diagnostic tool that can be used to determine the severity and the extent of ulcer formation or ulcer formed. Next is appendicitis. Next is peritonitis. Next is those piles. That piles can be termed as a hemorrhoids, right? Hemorrhoids or the piles. Next is certain conditions that is associated with the accessory organs of the digestive system. That is, fatty liver can be seen, hepatitis. Next is cirrhosis of the liver or the liver cirrhosis due to the alcoholic. In cases of alcoholism, it can be seen. Next is gallstone, and in many cases, even stone can be formed in pancreas. So this is all about today's class, and I request all of you to subscribe this channel, that is Pharmacology Talks, and kindly press the bell icon so that whenever I upload any new video, you will receive the notification for the same. Thank you very much.